Welcome to the Practically Healthy Life Show with your host, DrTursha Hamilton. Our goal is to educate, inform, inspire, and empower you to better health and to motivate you to make good health a practical part of your daily life. If you have any comments or questions about today's topic, post them in the comment section, or you can send an email to info@practicallyhealthy.org. Now, just sit back, relax, and enjoy today's topic.
Greetings and welcome to the Practically Healthy Life Show. I'm your host, DrTursha Hamilton, and today I wanted to talk to you guys about the new hypertension guidelines that were just released less than a month ago by the ACC and the AHA, and how those changes might affect you. So first things first, the hypertension guidelines, meaning the definition of hypertension, the different stages of hypertension, those guidelines had been around for 14 years. They last were changed in 2003. Which means that the guidelines that we had been working to prior to last month were approximately as old as some people's children. So over that time, the American College of Cardiology and the American Heart Association has done research, they've done surveys, they've monitored people, they've monitored patient conditions, patient outcomes to see if the guidelines that were set previously were still valid and how hypertension, how different blood pressures affect health. So that is the goal of the constant monitoring by these organizations, to make sure that we classify hypertension, we classify blood pressures in such a way that we can connect with people, we can see where they are in their blood pressure, and we can intervene earlier when and if necessary. And by intervene, I don't necessarily mean just medications. When I say intervene, what I mean is if you can catch a trend toward hypertension early enough, you can avoid being classified as hypertensive. And so that's actually my goal for myself, because I know that I've had bouts of hypertension, and for the people that I work with, whether they're my family members, they are patients, they are clients, they are audience member. My goal is to help you understand what hypertension is, how the organizations that kind of oversee these guidelines are defining it, and giving you the information what you need to help you be able to monitor and control this condition better, so that you don't end up a casualty. You don't end up having more problems down the line because it was ignored, or it was misdiagnosed, or it was mistreated. So I want to start off by reading a little bit of information that I'd gotten from the American College of Cardiology website about the new hypertension guidelines. It says here that the new guidelines lower the definition of high blood pressure to account for complications that can occur at lower numbers and to allow for earlier intervention. The new definition will result in nearly half of the U.S. population having high blood pressure, with the greatest impact expected among younger people. Additionally, the prevalence of high blood pressure is expected to triple among men under age 45 and double among women under 45. The guidelines author note, however, only a small increase is expected in the number of adults requiring hypertensive medication. So what does this mean? This means that by changing the definition of hypertension the way it is, more people will automatically be defined as hypertensive as opposed to pre-hypertensive. And again, the reason why they did this was because they saw that people with blood pressures that were higher than the quote unquote normal, but lower than the classification of high blood pressure, were having damage to their bodies, were having damage to their heart, to their blood vessels, to their kidneys and other organs. And so they wanted to account for these changes so that people can get intervention earlier. But again, this means that now more people will be classified as hypertensive. Previously, the systolic blood pressure. Okay, before I get into that even, let's talk about blood pressure. So when you're talking about blood pressure, you have two numbers. Usually you'll hear normal is 120 over 80. What that means is that you have the amount of pressure it takes for the heart to pump blood throughout the body, and then how much it relaxes. So the maximum point of pressure, of squeeze that the heart gives, and then the minimum amount of squeeze that the heart gives. So with that being said, the first number is always going to be higher. Previously, the systolic pressures, which is that highest number, was from 120 to 139 was considered to be pre-hypertensive. So when your doctor saw those numbers, they'd say you don't have hypertension yet, but we need to start monitoring it. And the bottom number, the diastolic number, it was a range from 80 to 89. That was also considered pre-hypertensive. So anywhere in either one of these ranges, 120 to 139, over 80 to 89 were considered pre-hypertensive. That would put a person at risk for high blood pressure in the future. Hypertension, on the other hand, or high blood pressure, was diagnosed once a person hit 140 or above or 90 or above. With that definition of 140 or 90 or above, it put about 1 in 3 adults in that category of hypertension. So if you had a blood pressure that was below 140 or below 90, then you were pre-hypertensive. Now, the new blood pressure guidelines state that normal is less than 120 over 80. So basically, if you have a blood pressure of 120 over 80, as opposed to something less than that, then you are now in the new category of elevated blood pressure. So elevated blood pressure is anything that's 120 to 129 and a diastolic pressure of less than 80. Stage 1 is 130 to 139 or a diastolic pressure of 80 to 89. And stage 2 is at least 140 or at least 90. A hypertensive crisis, meaning it's emergency, stop everything, go to the hospital, get some medications to get your blood pressure lowered, is a systolic pressure of 180 and or a diastolic pressure over 120. Now, I know these are a lot of numbers. I'm going to work on getting or finding a graph to show you the difference in these blood pressures. But basically what I wanted to let you know is that the definition of hypertension is now lowered. So you were walking around thinking your blood pressure was good, and all of a sudden you wake up and you are now in a new category for hypertension. One of the things you also want to note is that in this new classification, there is no such thing as pre-hypertension anymore. There's absolutely no such thing as pre-hypertension. The guideline classifications now are, I'll state it again, normal, elevated, stage 1, stage 2, and hypertensive crisis. If your blood pressure is elevated, that does not necessarily mean that you are going to be put on hypertension medications, but that is going to be a new consideration for you. If you are now in stage 1 hypertension, you will be prescribed medication if you already had a cardiovascular event, like something like a heart attack or a stroke, or you're at high risk of heart attack or stroke based on certain criteria like your age, whether or not you have diabetes, if you have chronic kidney disease, if you have atherosclerosis, just to name a few. So if you have any of those pre-existing conditions or you are at risk for any of those, then at stage 1, you will be likely prescribed a hypertension medication. If you are not within that high risk category, then you might not be put on hypertension medications. But again, with these new guidelines, your doctor is going to now start looking closer at your risk factors and possibly prescribing you medication sooner. So now is the time. Now is absolutely the time to start taking control of your health, to start doing things that will help you naturally decrease your blood pressure. Now, stay tuned over the next few weeks, over the next few months, because I want to give you more information about ways that you can decrease your blood pressure naturally, become healthy naturally, and hopefully avoid medications, definitely avoid complications and other problems that may be caused by having high, uncontrolled blood pressure. If you have any questions, if you have absolutely any questions about hypertension, if you have any questions about the new guidelines, please feel free to send me an email, info@DrTursha.com, info@DrTursha.com, or meet me on my Facebook page, Dr. Tursha. Again, that's DrTursha. Shoot me a question. I'll be more than happy to answer those questions. Again, over the next few weeks and the next few months, I want to really hone in on hypertension and what these new guidelines mean for you, and how you can empower yourself, start doing things that will help you to naturally decrease your blood pressure and hopefully reverse some of the damage that may have caused, even if you don't recognize it as such. That's it for today. I'm Dr. Tursha Hamilton. This is the Practically Healthy Life Show, and I look forward to talking to you guys in the very near future. Until then, have an awesome week. Take care.
Thank you for joining the Practically Healthy Life Show. We hope that today's show has given you the tools you need to form better habits that will allow you to build a stronger foundation of health. Stay connected with us at www.practicallyhealthy.org for the latest updates and upcoming shows. Or connect with Dr. Tursha via Facebook, Twitter, and Instagram at Dr. Tursha. That's DrTursha. Until next time, may your life be forever healthy, practically.